Hello, welcome to this workshop on the health consequences of fat phobia. My name is Maryannauger, my pronouns are she, her, and I'm a weight-inclusive, anti-diet certified personal trainer and group fitness instructor. So before we start talking about the health consequences of fat phobia, I just want to give a quick little content warning that I will be mentioning words like obesity, overweight. I'll be talking about weight stigma, racism, dieting, things like that. And as always, please keep the discussions respectful and appropriate in the comments. So let's start by defining fat phobia. What is fat phobia? A lot of people think that fat phobia means being afraid of fat people, and that's not what it is at all. It's actually the irrational fear of, aversion to, or discrimination against obesity or people with obesity. And I do find it ironic that this definition has the words obesity in it because the word obesity is stigmatizing in and of itself, but I will kind of talk about that later. So yeah, fat phobia is not about being afraid of fat people. It's discrimination against fat people and being afraid of gaining weight. Weight discrimination has actually increased by 66% in the last 10 years. And that was from a 2010 study. So I'm sure the percentage is higher now. And it even compares to racial discrimination in America. So let's talk about fat phobia versus skinny shaming, or fat shaming versus skinny shaming. So a lot of people will compare them and they're not really comparable. And let me explain. So skinny shaming or fat shaming, both of them are not okay. Okay. They're both bullying. They're both not cool. We should definitely not do either. And I wanted to kind of point that out first. So skinny shaming is more like someone will kind of look at a thinner person and tell them to eat a burger, for example. Fat shaming can be shaming someone or a fat person for what they're eating, but it's also a societal systemic issue. So fat people have harder times getting jobs. They don't usually get the medical care that they deserve. They can get kicked off of a plane. They are portrayed horribly in the media. And there's just so many things that we will actually get into in this workshop, but we can't really compare both because skinny shaming or skinny shaming or even diet shaming, for example, is not cool, something that we shouldn't do, but it's not a systemic issue. It doesn't stop someone from getting a job. You can still get clothes in pretty much all the stores if you're in a thinner body, for example. But fat shaming, weight stigma, fat phobia, it's a systemic issue and something that impacts fat people in a very big way. So we can't really compare both. And you'll find out more as we go through this presentation. And actually, this is something that is not talked about that often, or that not that I'm aware of, but the bigger someone is, the bigger the discrimination. So in the body acceptance, fat acceptance movements, there are some terms that some people use. I don't think it's as common anymore, but I have seen it go around. So things like small fat, mid fat, super fat, and infini fat. So those are kind of terms to describe different versions of fatness or different gradients, for example. So someone that is small fat may be wearing, and this is just a quick little warning that I will be mentioning clothing sizes. So for you, that's kind of triggering, you can skip ahead. But small fats may wear like 1X and 2X, whereas infini fat may wear like 6XL and plus. So the bigger someone is, the more discrimination they experience. And I think that's really important to consider as well. So let's talk about medical fat phobia. So doctors spend less time with obese patients and almost 10 minutes less for extremely obese patients. Waiting room chairs with armrests can be uncomfortable or too small. And medical equipment is designed for thin patients, stuff like scales, blood pressure cuffs, etc. And sometimes the equipment is actually stored away, or like the equipment made for bigger bodies would be stored away. So, you have to kind of sit there while the doctor is digging through his or her stuff or their stuff, just to get the proper equipment. And medical providers have little hope that fat people will implement healthy lifestyle changes. So there's two issues with that. One, it means that medical professionals don't think that fat people already have a healthy lifestyle. And two, it means that doctors don't have any hope that they will implement a healthy lifestyle. Regardless if it's relevant or not, patients are evaluated based on their weight first. So instead of kind of doing tests and looking at what the issue or what the person went in for, the doctor will recommend weight loss or talk about or give nutritional advice, or make them do like a blood sugar test to make sure they're not at risk of diabetes because they're in a bigger body, for example, instead of kind of helping them with what they came in for. Whereas for thinner patients or people of like straight size, well, they typically don't get that. They are usually, they come in, they have an issue, and the doctor will address the issue without talking about weight loss. And like I said earlier, the word obesity is stigmatizing, and that's because it comes from the Latin word obesus and actually means that has eaten itself fat. So words like obesity are to be avoided. Even in a medical setting, the word was just kind of made to be stigmatizing. And words like overweight, because it's kind of based on the BMI, which you can look at the workshop on the history of the obesity epidemic and BMI to learn more about that. But the BMI, that whole thing is very flawed for many reasons. But the word overweight means like you're over a normal weight. You're over this ideal weight, whatever that means, right? So it can be stigmatizing in that way because it means that you're over the correct weight or what you should be. And classifying obesity as a disease puts the blame on the person. So instead of acknowledging that people are born with various weights and that weight is affected by various things like genetics, environment, medication, and so many things, kind of instead of acknowledging that, you're just saying that obesity is a disease and it's your fault and it's your personal responsibility to not be fat because you are going to get sick, and that puts a strain on the medical system. And according to this study, family members and doctors are those who fat shame the most. All right, now let's look into everyday fat phobia. So fat people have to buy 2 plane tickets to get on a plane. Airplane seats are becoming smaller and smaller through the years, which are uncomfortable for straight size people and even more uncomfortable for plus size. And also, if you're fat, you have a chance of getting kicked out of the plane because you're taking up 2 seats because you have to buy 2 plane tickets. And if they need the space, they may kick you out. Seats at restaurants are too small. And they're usually, you can't move them. So when you go to restaurants, sometimes like the table will be bolted to the ground and the chair or the booth will be bolted down so you can't move it. And there's just very little space to fit in. So now this person in a bigger body came into the restaurant to eat and they can't fit. And that's probably not a very good feeling. And it happens in many other places as well. That just furniture isn't made for fat people. And fat people can't buy clothes in regular stores. So they either have to buy online because the store will only cater to plus sizes online because they don't want the plus sizes to come in stores because it kind of tarnishes their brand, right? Or they'll tell everyone that they're size inclusive or weight inclusive, but they only offer up to 1X or 2X, which is not super inclusive because there's still a big group of people that can't buy clothes there. And clothes are actually more expensive for fat people, and there's a big lack of variety. So let's talk about the fat tax, for example. So let's say there's a shirt at like Old Navy, and the straight size would be like $16.99 for this shirt. And then the same shirt in plus size would be $19.99. So it's the same shirt, but there's a different price for plus size and straight size. So that's what the fat tax is. Let's look at other examples of fat phobia. So a lot of people assume that fat people are weak-willed, unsuccessful, unintelligent, lack self-discipline, have poor willpower, and are non-compliant with weight loss treatments. So there's this big misconception and a kind of stereotype around fat people, that they're just lazy, they don't have any willpower, and so on. Fat people are actually less likely to be hired. This study said obese female candidates were judged as the least suitable for work. And again, it comes to those stereotypes and assumptions that fat people just aren't physically capable of doing things, that they're less intelligent, that they don't have self-discipline, and so on. And people often think that fat people are responsible for being fat because of lack of exercise and overeating. But in reality, like I said earlier, being fat is something that is affected by so many factors, whether it's genetics, environment, your medication, there's just so many things that affect your weight. And we shouldn't be putting the responsibility on anyone. And before we actually go into this, I kind of want to mention also that let's go back to people assuming that fat people are all these things, but it also comes down to how fat people are portrayed in the media. So when you look in movies, for example, the fat person is usually the clown of the show. They're the loser. They they don't usually have a love interest. They don't have a lot of like character build up, they're just pretty like a simple character with not much going on for them. They're either the evil character, so they're usually portrayed in a negative light. Same thing on social media. Let's say you look at documentaries, and if they talk about fat people, sometimes they'll cut off fat people's heads so you only see their bodies, and then they'll talk negatively about fat bodies. And the fact that they remove the head really dehumanizes fat people. So the representation in the media is something that greatly affects how fat people are perceived, and it really reinforces those stereotypes that we hear about all the time. All right, now let's talk about shaming into thinness. So a lot of people, and you'll hear this from certain doctors, trainers, and other people in the health industry, that you can just kind of, it's tough love. You can shame fat people into losing weight because you care about them and they just need to hear this from a tough love perspective. You're doing this for their own good. But that's not how it works. Personally, if someone starts telling me that I should implement healthy habits because I'm going to die, or, I shouldn't be lazy and I should start implementing healthy habits and blah, 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 it doesn't really encourage me. It actually makes me feel more shame. And that's definitely not good for my health and not super encouraging. And really, if weight stigma promoted healthier lifestyle behaviors and weight loss, then the fact that weight stigmatization, actually increased through the last decade, like that study was demonstrating at the beginning of the workshop, it should indicate a reduction in body weight instead of an increase. So we've been seeing the weight increase through the years, but if shaming people or weight stigma actually worked, well, we would see a reduction, and that's not what we're seeing. So let's look at a study that included 73 women. So 34 were overweight and 39 were normal weight according to the BMI. And they watched videos. Some videos were neutral, some were stigmatizing. And after the videos, they were asked to wait in a room with snacks presents and to make themselves comfortable. The overweight women who watched the stigmatizing videos ate 3 times as many calories as the overweight women who watched the neutral video. So if the person felt stigmatized, they would eat more. This other study, which is kind of following a similar concept, but instead of watching videos, it's reading articles. So some women were told to read some stigmatizing articles with title, for example, lose weight or lose your job. And some were told to read a non-stigmatizing article like quit smoking or lose your job. Women who perceived themselves as overweight, so they may not necessarily be overweight, but they perceived themselves as overweight. They ate almost double when they were in that waiting room with the snacks, and they felt less able to control their eating after reading the stigmatizing articles. And at the end of the study, they kind of concluded that regardless if the person was overweight or perceived themselves as overweight, the women in the study had increased concern about being victim of stigma for their weight, regardless of their weight. So basically, those two studies were saying that shaming people actually makes them eat more than it does help them, lose weight. So shaming people into thinness is not really something that works. And there are a lot of health consequences to weight stigma or fat phobia, and those are an increase in diabetes or having an increase of getting heart disease, an increase in exercise avoidance, early mortality, more inflammation, and more lipids, so fat and metabolic imbalances. Mental consequences, so eating disorders, an increased risk of eating disorders, disordered eating, body dissatisfaction, lower self-esteem, and depression. Let's talk about weight cycling, also known as yo-yo dieting. So that's when you go on a diet or try to lose weight intentionally, and then you start losing weight, and then the diet stops working, and then you start gaining weight, and then you feel ashamed, and then you start trying to lose weight again, and then it's that vicious cycle of gaining and losing. So that actually has a lot of health consequences. So weight cycling is not good for our health and increases our risk of blood pressure, increases our heart rate, our sympathetic activity, blood glucose, lipids, and insulin. It means that you may have more depressive symptoms and decrease in glucose tolerance, so you don't tolerate your blood sugar as much. And it has an association with increased mortality and morbidity. So let's talk about improving your health without intentional weight loss. So we've seen that weight loss or trying to lose weight intentionally, and we've mentioned this in the other workshops as well, but there is a 90 to 95 or 90 to 98% chance that you'll regain the weight after 5 years when you try to lose weight intentionally by dieting. So we know that sustainable weight loss is not something that works for most people, but we do know that you can improve your health regardless of your weight. So this study was looking at the association of cardiorespiratory fitness and weight status on mortality. And they came to the conclusion that compared to normal weight fit individuals, unfit individuals had twice the risk of mortality regardless of BMI. So you had normal weight fit individuals and unfit individuals, and the unfit individuals had a high risk of mortality regardless of their BMI. Overweight and obese fit individuals had similar mortality risk as normal weight fit individuals. So regardless of their weight, if they were fit and active, they had a lower chance of mortality, and they had a similar risk of mortality risk. Researchers, clinicians, and public health officials should focus on physical activity and fitness-based interventions rather than weight loss-driven approaches to reduce mortality risk. So this was the conclusion of the study, that we should focus on healthy behaviors like physical activity rather than weight loss to reduce the risk of mortality. This other study evaluated healthy lifestyle habits and mortality in overweight and obese individuals, and their conclusion was healthy lifestyle habits are associated with a significant decrease in mortality regardless of baseline body mass index. So it has a very similar conclusion that regardless of your weight, if you have healthy lifestyle or you're implementing healthy habits, then that's associated with a decrease in mortality regardless of your weight. So now that we talked about all of this, and you may want to learn more, because this workshop kind of like brushed, the complexity of the whole topic, and you may be interested in learning more. So there are a few books that I'm going to recommend. So the Anti-Diet book is a super good book. It talks about the history of diet culture. It also talks about, like in the first part of the book, it explains how diet culture steals your time, money, well-being, and happiness. And in the second part of the book, it gives you helpful tools to help you live your life beyond diet culture. So how to implement healthy habits basically without dieting. Now, these are two books. There's Health at Every Size by Lindo Bacon, and there's Body Respect, that is by Lindo Bacon and Lucy Aphramore. Both of these books address facts and fiction around fatness and how our body responds to weight loss. And both books give you tips on how to take care of yourself and improve your health without dieting or focusing on your weight. So if you want, they both address very similar topics. Body Respect is a little shorter. So if you're someone who doesn't necessarily like to read long books, I would highly recommend you read Body Respect. So now let's talk about Fearing the Black Body by Sabrina Strings. It talks about the racial origins of fat phobia. And I honestly didn't finish this whole book. I'm just like a quarter through, but the book is so good and full of really good information, and I highly recommend it. It talks about the racist history of diet culture and fat phobia. And understanding the racist history behind diet culture can help us push diet culture aside and focus on an approach that isn't stigmatizing and harmful to ourselves and others. And honestly, diet culture is also a proponent of white supremacy, and it's important to understand that so that we can do the important work of dismantling it. So this book just really, I like how my cat just decided to hang out in the background. so this book really helps understand the racist origins of diet culture, and it kind of helps us kind of like, personally, when I found out that, through the years, I stopped being a proponent for diet culture and I started, being more weight inclusive and following an anti-diet approach. But when I found out that diet culture had such a strong racist background, it made me want to reject it even more. So I think it's really important to acknowledge this background because many people aren't aware. And I just found out about this like a few months ago. So I think it's super important that we do the important work of reading about it and learning about it. So this is the presentation. I really hope you enjoyed it. Please let me know what you thought about it in the comments below. Please be respectful. And I will try to add my references in the description box. So that way, if you're interested in reading more about this and seeing where I got my information, you can look through all of my 35 references if you want to read through them. But yes, if you liked this workshop, please give a big thumbs up to the video and subscribe to see more. We'll be posting every single workshop that we did during our live Erasing Fatphobia workshop series, just so that if you missed it, you can watch it or watch the videos. Thank you so much for watching and have a great day.